Okay, looks like we are live. Welcome. This is Facebook Live number 21. It's been a while since I went live, actually. I think it's been a couple of months. So today is May 20th, 2024, and I thought I'd jump back on and do some more Facebook Lives on sleep. If we haven't met before, I am Dr. Nishi Bhopal. I'm a physician, psychiatrist, sleep physician, and I specialize in integrative medicine. So if you are joining live, thank you so much. If you're watching the replay, type replay in the comments and let me know. Today, I'm going to talk a little bit about sleep medicine fellowship. I get asked this question a lot by other physicians. I was doing a YouTube tutorial workshop thing a few months ago. I think it was like last year. And then one of the doctors was like, "What? You're a sleep doctor? How does that work? Do you have to do a fellowship? How long does it take? What do they do in fellowship? What do you do with your sleep medicine training?" She was asking all these questions, and other people were really interested. So I thought, well, I think there's some interest here, so we can talk about that. If you are a sleep doctor, let me know in the comments too. I'd love to hear your thoughts on this topic, or if you're a resident or if you're a physician who's thinking about going and doing a sleep medicine fellowship, I'd love to hear from you. Also, let me know where you're joining from, what your specialty is, what questions you have about sleep workup or sleep management with patients in your practice, and what some of your biggest challenges might be with managing sleep issues. So, okay, well, let's talk a little bit about sleep fellowship. We won't take too long today, but so I'll just start by sharing my own personal experiences with sleep. And I think a lot of us who go into sleep medicine fellowship have some personal issues with sleep. I know a lot of people who go into it have had their own issues with insomnia. A lot of sleep doctors themselves have sleep apnea. For me, it was more excessive daytime sleepiness and hypersomnia. Even since childhood, I was always way sleepier than my peers. I was always more tired than them. I noticed this during younger childhood, but also during adolescence, high school, and especially during university, I really struggled with sleepiness a lot. And then, of course, during med school and residency, where like you're basically sleep deprived for years on end. So that was a real struggle for me. And I couldn't really get a handle on it, and I didn't really know why or what it meant or anything like that. So anyway, so I had my own personal experiences with sleepiness, and I just remember one day feeling so tired in residency. It was after a golden weekend. For those of you who are not familiar with that term, it's when you get 2 days off in a row when you're a resident. And I think I'd like been busy that weekend because it's also your only time to like do fun stuff. And so I was busy and socializing, and then I was so tired on the Monday morning when I went back to my rotation. And we had to be there at like I think 6 or 6:30 a.m. for pre-rounds. And I was so exhausted. I was just crying in the shower that morning because I was so tired and all I wanted to do was sleep, and it was like painful. So these were some of my own personal experiences with feeling sleepy. And then when I was a resident, even though I'm a psychiatrist now, I started my residency in internal medicine. One of my internal medicine senior residents was going into a sleep fellowship. And I got really curious. I'd never heard of that before. I didn't know that was a thing you could do. And she was really excited about it, and she told me about the sleep lab at the hospital where I trained, which was Henry Ford Hospital in Detroit, Michigan. So I started looking into it. After my intern year, I switched into psychiatry, and I remained really interested in sleep because I was also seeing firsthand the link between sleep and mental health, and how it's really hard to get people feeling better if they're experiencing depression or anxiety or other mental health issues if they're not getting good quality sleep. So there's a real link there. So I started doing some rotations with the sleep lab there and decided to go ahead and apply for sleep fellowship, which I did. So I did that after my psych residency. And yes, you can do sleep fellowship after psychiatry residency. That's a common misconception that psychiatrists can't do it for some reason. Psychiatrists are physicians, and we can do sleep fellowship. And in fact, I think psychiatrists are really well positioned to do sleep because there's a lot of psychology involved in sleep. It's not just sleep apnea and sleep disordered breathing. So I ended up doing a sleep fellowship at Beth Israel Deaconess in Boston. Sleep fellowship is 1 year, and you can do it after a number of different specialties. And one thing I really loved about it was that it is multidisciplinary. So in my program, we had 3 fellows. There was me from psychiatry. We had a pulmonary critical care doc. She had done her Palm Crit fellowship, and then we had a neurologist. And then we also partnered with the pediatric sleep fellows, and so there was two of them. One was a child psychiatrist, and the other one, I think he was a pediatric pulmonologist. And so we sort of collaborated with them, and we're in pediatric clinic, a sleep clinic once a week, and stuff like that. So yeah, so that part's really fun. And for me as a psychiatrist, I kind of missed the quantitative aspect of things, of being able to measure things. And so it was really fun to be able to read sleep studies and have these very tangible things to hold on to, because psychiatry can sometimes feel a little bit intangible as well. So it's nice to have that counterbalance. So let's see, other specialties that can do sleep. So I mentioned internal medicine, and then internal medicine specialties, psychiatry, pediatrics, neurology, family medicine, ENT, and anesthesiology. If I missed any, let me know in the comments. And then one of the questions I get a lot is sleep fellowship worth it, and how do you practice it? Well, for me, it was totally worth it. I love sleep medicine. I think it's so fascinating. And I think that if you're interested in it, then it's totally worth it. And for me, I practice it in different ways. So how doctors might practice. So many doctors will go on and work in a sleep clinic. They might work in a hospital-based sleep clinic or a private practice-based sleep clinic. You can also partner with sleep clinics and do interpretation of sleep studies. So that's one thing that I do on the side. I have a psychiatry private practice. It's an integrative psychiatry practice called Pacific Integrative Psychiatry. We're in California. And then on the side, I have a side gig interpreting sleep studies for a local sleep clinic. So that's something you can do. Of course, you can go into research or academia if that's something you're interested in. Public health is also a big aspect when it comes to sleep. 1 in 3 adults in the US is struggling with sleep deprivation. So it is a public health crisis as declared by the CDC. So public health is an important aspect of sleep. And then of course, entrepreneurship. I think as physicians, we're very well positioned to be entrepreneurs just with the knowledge and the skills and the work ethic that we have. So for me personally, like I was saying, I have my private practice. I do interpretation of sleep studies on the side, but my passion is really education and teaching, and so I do a lot of that. I've got an online platform on YouTube, which is all about sleep education for physicians and therapists, and then I've got an online course for physicians and therapists called the Clinical Sleep Kit. Doors will be opening to that in a couple of weeks, so I'll share more about that later. And then of course, private practice as well. And so there's lots of different things that you can do with sleep. But even if you're not doing any of those things, like even in my psychiatry practice, I use a lot of my sleep medicine skills, even though I'm not specifically seeing patients for sleep issues, because every single patient has to sleep, right? So even if you are not treating sleep apnea, narcolepsy, or other specific sleep disorders, you do need to have some fundamental understanding of sleep medicine. And most physicians only get about 2 hours of sleep medicine education in medical school, which is kind of crazy, right? Because every single patient has to sleep. Like, name one patient that doesn't need to sleep. But we get such little training in it. So that's also one of the reasons why I started my sleep education program, so that people can, clinicians can learn sleep medicine without having to go and do a fellowship. And you can fill in the gaps in the knowledge, because you don't necessarily need to be treating complex sleep apnea or, severe hypersomnias and things like that. You can refer out for that. But with the ratio of only about 7,500 sleep doctors in the US, that's a 43,000 to 1 ratio, 43,000 patients to every 1 sleep doc. Even if we train more sleep doctors, there's not going to be enough to see all the patients who need support. So that's my soapbox. That's why I think it's so important that all clinicians get a really good grounding and foundation in clinical sleep medicine. So it's really fun. If you have questions about sleep medicine or sleep fellowship or what it entails, let me know in the comments. I'll be happy to share more about my experiences. And then I'll just share a little bit more before we jump off here, which is that one of the things that I was always really interested in as well is integrative medicine. And so when I was doing my sleep fellowship, we learned about sleep disordered breathing. We got, of course, really good training in how to manage that. We also learned about CBTI and management of other sleep disorders. There's over 80 different sleep disorders described in the ICSD-3, which is the International Classification of Sleep Disorders. It's not all just sleep apnea and narcolepsy and insomnia. There's so many other aspects to it. But what I got really interested in was integrative medicine. And we didn't really learn a lot about that in sleep fellowship. So that's something that I've kind of embarked upon on my own with my own self-study, and now there's different courses you can take in integrative medicine, and there's different fellowships you can do in integrative medicine and psychiatry. So I did a fellowship in integrative psychiatry through the IPI, which is the Integrative Psychiatry Institute, and now I teach their integrative sleep medicine module. So a lot of the integrative and holistic stuff I've kind of learned on my own. There's a few of us integrative sleep medicine docs out there. I actually have I have it right here. I'll show you the integrative sleep medicine textbook. I'll just grab it 1 second. Okay, so here's the Integrative Sleep Medicine textbook, edited by Dr. Valerie Cacho, who's a great friend of mine. She's an integrative sleep doc in California and Hawaii. So there is a small cohort of us who do integrative sleep medicine, and that's really the focus of my program for clinicians, the Clinical Sleep Kit. Dr. Val Cacho is one of our experts inside the program. So again, I can share more about that later. If you're interested in learning about that, just let me know in the comments. I'll talk more about that on future Facebook Lives. So I hope this was a great overview for you on sleep medicine and what it entails and who can do fellowship. If you want to learn more about sleep and just up-level your sleep medicine skills, get my free sleep mini course. You can grab it using the link in the comments. I believe it is there. And it's just filled with lots of different tools, high-yield tools that you can use in your clinical practice with your patients. So you can take that course. It's really easy, and hopefully it's easy to understand. People have told me that it's just nicely laid out and they were able to use it right away. So get your copy of that, and then any questions, let me know in the comments. And I'm planning to do just little quick lives on different sleep tips and aspects of sleep medicine every day for the next couple of weeks. And then I'm also here to answer any questions about my clinical sleep program if you want to learn more. So I will say bye for now, and I'll see you tomorrow.